Dengue fever. Dengue virus is a flavivirus, single-stranded positive sense RNA virus belonging to the arbovirus group. So it is transmitted by an arthropod, mainly a mosquito. In this case, it's the Aedes aegypti mosquito, which is the vector. So because of mosquito bite, the dengue virus enters the body, and most of the patients or most of the people who have good immune system will be asymptomatic. People with who do not have a good immune clearance of the virus will either present with febrile illness, okay, just the febrile phase, and these people will recover with the febrile phase without any complications, or they may have hemorrhages because of decreased platelet count. So symptomatic patients can have hemorrhages or can be sent home after a few days of fever if they do not have hemorrhage. And this hemorrhage is because of decreased platelet count, and which is called thrombocytopenia. So the critical phase is where the patient has dengue shock, dengue hemorrhagic fever, and dengue shock syndrome. These are standard abbreviations, DHF and DSS. So if the dengue hemorrhagic fever develops, the patient develops shock, then it is dengue shock syndrome, or he can just have a dengue hemorrhagic fever. So what is the difference? As you know, with the dengue infection, there is thrombocytopenia. This is the main effect, a decrease in platelet count, which causes the hemorrhage. So hemorrhage is because of decreased platelets, because platelets are the cause of clotting in the human body. So when the platelets are reduced, clotting is disrupted and there will be hemorrhages in internal organs in different parts of the body. Along with that, the immune system secretes a lot of chemicals which will cause the endothelial cells in the capillaries and venules to produce gaps. Okay, because of dilatation, there will be gaps produced between the cells. And these vessels are made up of single celled walls. And because of this, the cells will produce the gaps between them, and the fluid will leak. And when the fluid leaks, there will be a shock, or the blood pressure will decrease. That is the shock. Therefore, the blood is going out of circulation and it is happening within the body. It's called third space leak. Okay, so because of that, there is a drop in BP because of decrease in fluid in the circulation, and this leads to dengue shock syndrome. So this is called dengue hemorrhagic fever, and a febrile phase with healing and muscle pains is called dengue fever. So the platelet count is decreased because of low production, increased consumption, increased destruction, and direct infection of platelets by the virus. Okay, so in low production in the bone marrow, increased consumption because of DIC, increased destruction by activated macrophages, which is the own immune system, and then there is direct infection of platelets, which will kill the platelets. So this is the reason behind the clinical symptoms